Hi, you're welcome to my channel. Today we're going to be dealing with pelvic inflammatory disease, PID. PID is a disease of the upper female genital tract. It is a spectrum of infection and inflammation of the upper female genital tract organs, typically involving the uterus, inner part known as endometrium, fallopian tubes, ovaries, peritoneum, and surrounding structures. These instructions usually spread from the vaginal cervix through the uterine cavity to the tubes and other parts. Pelvic inflammatory disease is an important topic because it results in tubal damage, leading to ectopic pregnancy and tubal factor infertility. I'll do a separate health talk on ectopic pregnancy, but be informed that ectopic pregnancy is common and many young women have lost their lives from ectopic pregnancy. The causes of PID include the following. Chlamydia trachomatis and Neisseria gonorrhea are the commonest organisms. The rest organisms are as follows, but not restricted to the list. Gardnerella vaginalis, Haemophilus influenza, Eneros lyobacteroides, Staphylococcus. In fact, PID has been noticed to occur following abortion and delivery. Why is one female more likely to suffer from PID than another female? These are risk factors. Note that the classic high-risk patient is a menstruating young woman, younger than 25 years old, who has multiple sexual partners, does not use contraception, and lives in an area with high prevalence of sexually transmitted infections. Then history of sexual abuse, history of prior STIs, frequent vaginal douching. Look at the health talk video on vaginal health. You understand what I mean by this. Then use of intrauterine devices, living in areas with high prevalence of STIs. Gynecologic surgical procedures which affect the cervix, such as endometrial biopsy, curettage after termination of pregnancy. Then hysteroscopy. These procedures break the cervical barrier, predisposing women to ascending infections. Most cases of PID are presumed to occur in two stages. First stage, acquisition of vaginal or cervical infection. This is often sexually transmitted, and the patient may be asymptomatic, so the patient has it but does not show symptoms, so the infections are there lying in wait. The next stage is direct ascent of these microorganisms from the vaginal cervix to the upper genital tract, with infection and inflammation of these structures. This is the reason gynecologic procedure that affect the cervix is seen as a risk factor, because it increases the likelihood of infections ascending to the uterus and fallopian tubes from the cervix and vagina. Clinical features of PID. Note that some patients are asymptomatic, but the following can be seen. Pelvic pain and deep dyspareunia. This means pain during sexual intercourse, during deep penetration. The patient will have this severe pain. It is seen as infection ascends into the uterus, fallopian tubes, and the ovaries. Please note that there are other causes of this symptom. Then intermenstrual bleeding, bleeding between your menstrual flow. You have your first period, then before the next date is due, you have another bleeding. This may be seen when the infection affects the inner part of the womb, your endometrium. Then painful sensation when urinating, lower abdominal pain, abnormal vaginal discharge, which becomes purulent and offensive. Then you have other symptoms like nausea and vomiting. Some people can have fever. The diagnosis of PID is made by your doctor and is based on the following. First of all, the history of pelvic pain and deep dyspareunia. On examination, your doctor will notice cervical motion tenderness with or without adnexal and uterine tenderness. In some severe cases, the woman will have fever. Then lab tests will show raised white blood cell counts, raised erythrocyte sedimentation rates. There can be adnexal mass. Then there's a feeling of unwellness for some women. Chlamydia infection can be diagnosed by specific tests. Meanwhile, the gold standard for diagnosis of PID is laparoscopy. This implies a direct visualization of the peritoneal cavity and the abdomen. So the doctor makes a small incision and puts in a probe that has a source of light and connects it to a computer, and then watches what is happening inside your pelvis and the abdominal cavity. The most important diagnosis to execute acutely when a patient presents with these symptoms is ectopic pregnancy. If there's any doubt of possibility of pregnancy, urine test is usually done for the patient, because if, you know that ectopic pregnancy can really occur once the tube is blocked. So once you notice that a patient has symptoms, the doctor is eager to know whether there's pregnancy, and then the patient is taken care of. So please, once you have these symptoms, please go see your doctor. The treatment is basically antibiotic regimen, which will cover both chlamydia and gonorrhea, as well as other anaerobic organisms, because they are the commonest. Then partner notification is an important part of management. They will do contact tracing, investigate your partner, your husband, and those you've had sexual intercourse with, so that everybody will be treated. Then in severe cases, patient is hospitalized for intravenous antibiotic therapy. Then there can be surgical procedures done if the patient has indication for it, like pelvic abscess. So patient has to be thoroughly assessed to note these things and take care of them. Patients who are not responding to outpatient therapy for after 48 hours, following full course of treatment, we need to be admitted. Then after treatment, patients will have to go through series of cultures, like maybe 2 different cultures and tests, to be sure that the organisms are no more there. They take, swabs are taken from the cervix, or what we call high vaginal swab, and then you just check them in the lab to make sure that the microorganisms are not there, and then your genital tract is clean of these organisms. Please avoid going to medicine stores or going for self-prescription. Go see your gynecologist for proper diagnosis and treatment. PID is common and it has severe complications. The complications will include tubal damage leading to ectopic pregnancy. Then there's infertility, tubal factor infertility due to tubal blockage or damage to the wall of fallopian tubes. Then chronic pelvic pain. Some men will complain of pain in their pelvis for a very long period of time. This may be due to a PID that was not treated well. Then there's also other things like interabdominal spread of gonorrhea is what of gonorrhea can cause affection of the outer part of the liver. That's what we call perihepatitis, and so many other conditions. You see how far PID can go, so you have to take it very seriously. Then prevention. Most chlamydial and gonococcal infection are asymptomatic, so the best is safer sex and screening. They are the best methods of prevention. Your partner and you will be screened for gonorrhea and chlamydia before you resume sexual intercourse with the person. The more than 50% of women infected with gonorrhea have concomitant chlamydial infection. Therefore, chlamydia treatment is prescribed routinely for all women with gonorrhea. That way you can prevent PID that is caused by chlamydia. And then there should be increased public health awareness, just like we are doing with this health talk. So please share this video so that you can help to prevent PID. Then use of contraceptives also help. Then adolescents are at increased risk of PID, and therefore they should delay onset of sexual activity. Abstinence is your best strategy. By way of conclusion, PID is a major problem to the reproductive health of young women, and some women shy away from seeking specialist care when they have symptoms relating to their reproductive system. And then, severe complications can arise. Some patients present with complaints of infertility after many years of living with this infection. Please act fast before it becomes too late. I want to encourage you, give your health the best care, nothing short of it. Don't go for over-the-counter drugs. Walk into the hospital and consult a gynecologist and have a clean reproductive system so that it can help keep your tubes patent for reproductive functions. Once again, thank you, lovelies. As the day goes by, I get attached to all of you who make our time to learn from this channel. I love and cherish you all. Please do well to share this with everyone, male and female alike, and teach the girl child to live right. Subscribe if you're yet to, and then tell your friend to tell your friend that Juliana Ome is always here to bring important information your way, always. Thank you very much, and see you again.